Hi, my name is Lauren Robertson and I will be presenting Unit 8, The Roles and Responsibilities of a Midwife. In my presentation, I will be discussing the recent changes and the impact it's had on the role and responsibilities of a midwife. Discuss the impact of the midwife in meeting physical, social and psychological needs of a woman and her family. The role of the Nursing and Midwifery Council in relation to midwifery practice. An analysis of the implications of the code on midwifery practice and the role of a midwife. An explanation of the need for the effective communication in a multidisciplinary in a healthcare setting. Evaluation of the effectiveness of the multidisciplinary approach in a healthcare setting, including positives, limitations, and effectiveness. Just before we start, I will be referring to a midwife to she, her, and woman in this presentation. In 2021, there was approximately 53,000 midwives in the UK, and only 0.4% of that was a practicing male midwife. Midwifery is a woman-based role and has been throughout history because we are the only biological sex that can experience pregnancy, labour and childbirth. Let's just start off by discussing what a midwife is. A midwife is a healthcare professional who provides support for mothers and babies from 8 weeks gestation right up to 28 days after birth. A midwife is available 24 hours a day and has extensive knowledge through education and training that concentrates on health and well-being of mothers, families and newborn babies. A midwife has many competencies and specific skills such as family planning, pregnancy, labour, birth, postpartum period, newborn care, women's mental health and social and cultural context. What role a midwife plays in pregnancy and birth? A midwife is there to support and advise through the first, second, third and fourth trimester. There will be numerous appointments to check on a woman and her baby and offer close family support. Her role is to guide the mother through the pregnancy journey with compassion, knowledge and kindness. There are steps a midwife must take in each trimester, such as taking blood to make sure the hormones are being produced to maintain a healthy and happy pregnancy. Measuring of the abdomen to make sure there's a right growth milestones are being met, and it is also important the assigned midwife checks on the mother's mental health and offers solutions to or outside help, as pregnancy isn't the same for everybody. A midwife's responsibility is to be a woman's advocate by ensuring that mothers retain choice every step of the way in pregnancy, labour and childbirth. How does someone become a midwife? A midwife must go through extensive training and education and regulation to become a full licensed midwife in the UK. She would have to get a bachelor degree in midwifery through a 3-year course of university. Midwives must be registered through the NMC, the Nursing and Midwifery Council, to practice. Where a midwife would work. There are lots of different fields of employment. In the UK, most midwives will go to the NHS, providing both hospital and community care. Hospital midwives are based in a hospital obstetric and consultant unit, a birth centre or midwife-led unit. Community midwives are often working teams and provide a continuity of care. There are varied levels of care such as community, NHS and independent. Question 1. The recent changes and impacts that has had on the responsibilities of a midwife. I'm going to give 2 examples of recent changes and impacts. The first example is the King's Fund. It's an independent charity working to improve health and care in England. The charity has made a recent change that has improved the expectation of healthcare professionals. The courage of compassion supporting nurses and midwives and delivering a high quality of care is an independent report that was founded by Michael West, Susie Bailey and Ethan Williams. It is commissioned by the RNC Foundation, the Royal College of Nursing. This new report brings light to mental health strain that the nurses and midwives go through every day due to such a high demanding career. Mental health is very present in the healthcare professionals and recognised on such a wide spectrum. Now in 2022, there's a worrying decline within midwifery sector that authors of this report believe due to the strain of COVID-19 and has created a bigger mental health issue that has led midwives to leaving their career. This report has a goal to implement 3 needs that must be for every nurse and midwife to improve well-being, low workspace stress and keep motivation going forward. These changes are hope of bringing the right tools to support midwives throughout their career of the NHS. Anatomy, the need to have control over work life and gave the balance needed to act consistently with their values. Belonging, the need to feel connected, valued, cared for and supported within the workplace environment whilst caring for others around them at work. Contribution, need to experience the effectiveness in what they do and deliver valued outcomes. The second impact. A 2016 NHS England published a policy document called the Maternity Transfer Programme, known as Better Births. This programme stands by safe, effective care wherever and whenever it is, provided across the whole of the NHS. This independent maternity working group is led by professionals that know the area that need improvement. It is focused on safer births by 2030. By 2030, the vision from this programme is to have halved the rate of stillbirths, neonatal and maternal death through brain injury. This ambition is great recognition to tackle the high rates in death in babies. Better Birth focus on delivering service that works safely, quickly and effectively in any situation that occurs, focusing on maternity care. This means for the NHS staff working under the maternity section that safer precautions will be taken out of greater quality of care during pregnancy, labour and childbirth. This programme has started to have a huge impact on the responsibilities of a midwife. By continuing to provide a key role in the maternity sector within the NHS, also to keep improving the health of the population in highly disadvantaged areas, this is crucial to keep providing the high quality of service to keep productivity. This is a very important impact that will go on for the foreseeable future. Question 2. The impact of meeting the physical, social and psychological needs of a woman and her family. Many women and families have recognised the complex physical, social and psychological needs living in the UK, including families living in poverty, women who do not speak English as a first language, teenage mothers, women who are abusing drugs and alcohol, women who are struggling with obesity or long-term conditions. Midwives optimise normal psychological processes to support the safe physical and psychological care. They are there to provide health education, health promotion and health protection to promote psychological and physical safety and well-being. Therefore, it's vital that midwives work in partnerships with other agencies such as health, social and voluntary services, as this is the key to empowering and supporting women to enable good health and well-being for themselves and their children. The routine support from the midwives during these meetings could include how to recognise labour, whose point of contact, breastfeeding, emotional support, growth checks, hormone checks, advice for social groups for after the baby is born. In a midwife meeting the needs of women, she is required to understand the aspect of not only physical movements of childbirth, but antenatal, perinatal and neonatal. Also the cultural, emotional, social and spiritual experiences. Midwives have a key role to ensuring that contributing is a positive experience by showing patience and non-judgmental sensitivity to each woman. The impact from meeting these needs will lead to a better relationship between the patient and the midwife, creating a safe space that will have the best interests of both mother and child. The impact for not meeting these needs have been proven to raise stress in pregnancy. Poverty and social exclusion are known to be linked to preterm delivery, low birth weights and high rates of maternal mental health problems. All of these factors could potentially affect a child's early life experiences and a child's early physical, social, emotional and language development. Social and economic conditions have effect on the population's health and well-being, such as low economy, cultural and lifestyle and community. Question 3. The role of nursing and Midwifery Council to midwifery practice. The Nursing and Midwifery Council, the NMC, is a charity that regulates all nursing and midwifery practice in the UK. The NMC makes sure that all healthcare workers comply with all the right legalisations to practice and maintains the registration of all practising nurse and midwives. The NMC was established in 2002, replacing the health organisation called the UKCC and the General Nursing Council for England and Wales. These two were the original foundations from the Nursing Acts in the 1919 that oversaw the right to practice nursing and midwifery. The role of the NMC is to monitor all education courses and keep the record of training students who pass university with the degree to practice. The NMC sets the standard of education, training, practice and conduct all for nurses and midwives in the UK. The purpose of the NMC is to keep the public safe by ensuring that registered nurses and midwives are qualified and they have the right skills and behave in the way that meets standard expected of them. Each nurse and midwife that is practising must be known by the NMC and up to standard by the publication of the code. The NMC have implemented the rules and must be met by the nurse, midwife or healthcare professional, or they will lose the right to practice and be cautioned on their behaviour. If the offence is serious, then there can be hard consequences like being struck off, which comes with the nurse and midwife's name being removed from the register and never to work in the health sector again. Revalidation is also a key process of keeping all nurses up to date with the relevant skills and knowledge in progressing in the ever-changing career. All of this is held through the NMC. Question 4. The analysis of the implications of the code to midwifery practice and the role of the midwife. The code is commended by the NMC, and from 2001 it was originally legislated and brought forward to the Parliament, but it was taken over by the NMC. The code is a series of statements that signify what a good practice is by nurse and midwives and nursing associates. The core values are to regulate and ensure the high level of standard of practice is achieved across the UK. It is a guide standard of practice on the midwives or nurses that should always be provided trust through professionalism, prioritising people and practising it effectively and preserve safety throughout the career. The implications of the code required a midwife not to act outside of her skills, knowledge or competence, meaning to use the tool the midwife has learnt during training and education based on knowledge, not opinion or feeling. Throughout history, there's been many factors that have led to the foundation of the code. Midwifery can be tracked right the way back to pathological times in 40,000 BC. Over the centuries, some midwifery practice have remained the same and others have changed with modern laws, refined acts and technology. In the 15th century, the midwives were bound to certain tasks due to the oath and licensing system that enacted through the church. The 1512 Renaissance was the church parliament allowing midwives to practice under the licence that was given from the bishop. Midwives back then were summoned during delivery only to make sure the baby was in good health, and that went on right up until the late 1800s. The practice of midwifery began to evolve in 1840. Some male midwives began calling for the abolition of women in the field due to their incompetence. Midwives came together to change the order. Louisa Hubbard, who set up a group known as the Matron's Heir, turned into the Trained Midwives Registration Society. The Midwives Institute became the Royal College of Midwives, and in 1890 the first bill of the Midwives Act was introduced into the House of Commons, but the Act wasn't passed until 1902. At the beginning there was only an expectation of a requirement that had 3 months training that increased to 6 months in 1916 and then to a year in 1926. This act required midwives to become certified through education and training. From this act, they established a midwife board which regulates the certifications and keeps the register of midwives who practice the training and education. The Midwives Board regulates examinations. In 1970, the National Health Reorganisation Act 1973 the way midwives practiced so there was no longer need to be controlled by the local council, but was employed by the National Health Service. This was the birth of the Real Pill Report, which stated every woman should have access to hospital care and modern medicine. Public Health England is an offspring of the Department of Health and Social Care that reformed in 2012. The standards seek to protect the improvement of mental health of the general public by examining social and economic factors with the aim to positively impact health and well-being. Public health was reformed in 2013, adapting interventions which vary in pregnancy from smoking support, mental health and domestic abuse. Public health is an important part of midwife's role. All these significant time and histories have led to the statement implicated by the Code in the form of the Regulations, Education and Training. The standards of midwifery practice, still to this day, is all down to the women who fought, died and stood by the right to regulate the natural processes of pregnancy and birth. Question 5. Explanation of the need for effective communication in a multidisciplinary in a healthcare setting. Multidisciplinary means a group of professionals working together. A multidisciplinary care is a unified group approach in a healthcare setting where the responsibilities of a treatment plan and delivery care doesn't fall on one person, it's shared amongst the allocated team. During this time, a midwife works closely with a GP and obstetric for a patient-centred treatment plan or options to collectively develop a solution for a person and family. Collaborating in a maternity healthcare with other medical staff is crucial to delivering a high standard of maternity care for women. Working with maternity support workers, maternity care assistants, health visitors, public health practitioners, social care colleagues and specialist workers to respond to complex health and social needs of some women. Midwives are a key coordinates of maternity care throughout pregnancy, being the point of care whilst working alongside other members of a multidisciplinary team. When it comes to using effective communication in a multidisciplinary healthcare setting, needs effective contribution from each member of the disciplinary team. A successful partnership is timely, effective communication that results in a specialist works responding to the physical, psychological and social needs of a woman and her family. Poor communication is ineffective teamwork that can lead to misinterpretation of statutory healthcare needs and is breaking the code rules in the level of care that is expected of a midwife and any healthcare professional. Strategies of effective communication in a multidisciplinary healthcare setting. Always practice in line with the best available evidence. Communication needs to be clear. Work cooperatively. Share your skills and knowledge with the colleagues to get the best possible care to the person receiving it. Keep clear and accurate records relevant to the practice. Be accountable in the team that you've been assigned to. Question 6. The effectiveness of the multidisciplinary approach in midwifery. Multidisciplinary care is beneficial for both patients and healthcare professionals. It ensures the improvement in a healthcare services, treatment and outcomes to create direct and better access to healthcare facilities and information. Patients have a better chance of early diagnosis and treatment because they're a multi-professional team from different fields with more knowledge in different areas which enhance the satisfaction. There's also access to high quality clinical care. From using the effective communication in a multidisciplinary approach, on the screen is a table of pros and cons that I'm going to list a few examples through positives, limitations and effectiveness. Positives: better access to healthcare, improved outcomes, more detailed treatment plan, high level of treatment and quality care, coordinated support from numerous specialists. Limitations: distractions in medical workers, colleagues sharing difference of medical opinions, stress legal issues, treatment delays due to staff and time. And effectiveness: approved better care and coordination, improved patient outcomes, smooth pathways for treatments, reduced duplicated services, better opportunities for healthcare experts.